Thank you, Sebastian. It's great to be here talking with the Endurance Club. It's very cool that this group has been getting together for so many years, and I know working with Dr. Harris, who's the medical director for the marathon, that he very much appreciates everyone's support and participation and staying active and working towards their goals. So. Today, we've been asked to talk about kind of injury mitigation and getting ready for whether it's the marathon or just kind of getting going into running, ways that you can do that, thoughtfully and reducing your risk of injury to get all the good health benefits, both cardiovascular and for the musculoskeletal system. Also, running can be a very therapeutic thing psychologically. So, we'll be digging into that, talking a little bit about prepping over the next couple months for the marathon, but also integrating some strategies, whether you're a seasoned runner or new to running, things that we can do to stay healthy. So again, my name's Charlie Kenyon. I have some background in the injury prevention and sports performance world. So before I went to medical school, I was a strength and conditioning specialist and sports science coordinator with the Seattle Mariners. So it's very exciting to see all that success coming into this last week of the season here. So go Mariners. But then I went on to medical school at the Texas College of Osteopathic Medicine in Fort Worth, Texas, before coming back home here to Seattle at the University of Washington for my residency in rehab medicine. Before going out to Emory University in Atlanta for my sports medicine fellowship. And currently, I'm a practicing sports medicine physician 3 days a week at the Sports Medicine Center at Husky Stadium down on the Montlake campus, and then twice a week here at Harborview Medical Center, where I'm here currently on Tuesdays and Thursdays. Like Sebastian said, as we go along, uh, feel free to drop any questions in the chat. I've kind of tried to keep it a little more kind of practical and condensed. So hopefully we have some chance for some Q&A at the end, and I think we'll have ample time there. But like I said, my background is as an osteopathic physician. So with that, just kind of give an osteopathic shout out. We operate kind of on these four core tenets. One is that the body is a unit, and the person is a unit of mind, body, and spirit. And I think that's a very tangible thing here for this discussion of healthy training and injury prevention. Also, the body is capable of self-regulation, self-healing, and health maintenance. This idea that structure and function are reciprocally interrelated, and that putting together a rational treatment plan, whether that's treating an injury or trying to prevent an injury, that by taking a holistic approach that we can have the best outcomes. So again, as we're thinking about factors that play into injury risk, I do think that there's not only the physical side of that, but also the psycho-emotional, other stresses that can come into play as well. So what are some components that we can think about, both from the performance perspective and then recovery? So those are things like strength, your cardiovascular conditioning, how's your sleep duration and quality? What are some other stressors that might be going on? How are you integrating rest into your training plans? Certainly nutrition can play a big part there. What are the loads that you're doing running? That's both intensity, what kind of course are you going on? Is that flat roads, hills? And then what's the progression of those loads? Has it been kind of slow and steady? Or are you kind of coming to the last minute preparing for a race and having drastic increases in those acute workloads, trying to catch up on time? We also talk about biomechanical factors, and another thing that can be really important to consider in both how you're designing your training plans and then where you're putting some of your focus is individual injury history can certainly be a strong predictor of future injury. So having had issues with your knee can be a strong predictor that you may have future issues with the knee. Common types of injuries that we'll see in runners are anywhere from patellofemoral pain, which is a tracking issue of the kneecap in its groove, commonly known as runner's knee, jumper's knee, or issues with the patellar tendon in the anterior knee. People can certainly have pain and injury with their outside of their hip or their lateral hip that can represent tendinopathy in the glute medius or glute minimus tendons. Hamstring issues can be very common, both kind of proximally on our sit bone or more distally around the back of the knee. IT band syndrome on the outside of the knee can be seen with repetitive overuse. And many people also have difficulties with their foot and ankle, whether that's things like plantar fasciitis, Achilles tendon issues, and then something that in certainly people who are doing a lot of high volume running, that we want to be aware of any potential risk of bone stress injury and stress fractures. That's a balance of load, energy balance, nutrition coming in, and then also similarly an area where if someone has a history of a bone stress injury, then we want to be really cognizant of that, both in diagnosing injuries and treating them as we're moving forward. Again, kind of common injury factors that we're taking into account. The question about SI joint being common, is certainly something that can be common as well, and we'll get into the importance of core strengthening and lumbo-pelvic strengthening as we move forward. But again, common injury factors. Have you had this type of injury before? Or are there certain underlying things in the mechanics or the risk factors that we need to address knowing that you've had this injury history? Things like overuse, and again, that can be both the total volume of training, but also in particular, any sharp spikes in that workload. So, um, if you kind of are gradual and steady, oftentimes people can build up a load tolerance over time. But when we try and rapidly increase our intensity or our mileage, we can be at risk of various different issues. Other risk factors that have been shown in different studies are having a higher BMI can certainly put stress on your joints. Those of have older age, you can see changes happen on our tendons and our joints, that can be common with aging. And I don't know if it's as much as being at increased risk of injury, but we just need to be that much more cognizant and thoughtful about how we're preparing for training, whether it's running or different workouts, and how we're allowing for recovery in between those bouts. Those who are new to running can also have um, uh, higher risk of injury just from a new stimulus. If it's something you haven't done before, you have to be, again, very gradual and progressive. As we'll talk about, recommend some strengthening strategies to prepare yourself for that repetitive impact activity. But overall, we're always weighing out these risks of any potential injury versus the benefits of running and being healthy, both, again, cardiovascularly, mental health, and then our physical health as well. If you're not taking in the right nutrition, that can certainly place you at risk for injury, particularly those bone stress injuries in our really high volume runners. Similarly, if you're not prioritizing some warm-up period in terms of getting out there and running, that can lead to some issues. And then again, where we're going to focus a lot today is some simple things that you can consider integrating into strength training or cross training routines to make sure that your body's prepared to get out there, not only to aerobically handle the load of running, but then also to um, uh, be able to support the structures of the ankles, hips, and knees, that as well as the lower back, things like the SI joint that were mentioned, to be able to get out there and run and stay healthy. So I picked a lot of these kind of pictures and routines that we'll go through from this study that I came across getting ready for this. It was a randomized control study, so kind of our highest level of evidence. They was focused on novice runners, but I think can be extrapolated to your running routines no matter what your level of experience is. So it had one group that were engaged in hip and core exercises, another group that were involved in ankle and intrinsic foot strengthening exercises, which we'll talk about a little bit, and then another group that, in addition to the running, all they were doing was a stretching routine, so no strengthening activity at all. I believe this was over the course of 24 weeks or so, both integrating this training program, following their running progressions, and tracking injuries. So think one area where it's been difficult to study the impact of injury prevention programs on runners is that there's a wide range of runner in terms of experience, the distance that they're running, what kind of things they're doing on top of that. So when we've taken bigger kind of marathon level studies, a lot of times those are kind of retrospective, kind of a snapshot in time, and it can be very difficult to extrapolate some of the information about what those people are doing and how it impacted their injury patterns. Ultimately, I think it can be a very individualized thing, but I felt like this was a good study, and they have an excellent kind of program and videos that I wanted to include here. So again, even though this is targeted for novice runners kind of just getting into things, I think there's some really strong programs here. So there's a QR link to the article website itself if you're interested, but we'll also have some links to some of the videos for those programs here coming up in a little bit. So again, this program had kind of 2 sessions of cross training per week. They treated it first as a warm-up period, getting into some exercises, and then after that, those runners would go out for another period of somewhere between 30 and 90 minutes and complete their running program. So they emphasized this idea of a dynamic warm-up, which was about 5 to 10 minutes. Work on getting the heart rate up, increasing body temperature, which we know to be helpful for reducing injury risk. And then also these activities do what we call activating the neuromuscular system. So not only increasing the heat in the muscles, but stimulating some of those fibers that help us know where the position and force activation of our different muscles are, just because we take for granted how complex the mechanics of running can be. So this QR link here takes you into a YouTube channel. If I did it right, that should show some different videos of these activities that we'll go through. But basically, very basic things. Just some short kind of back and forth jogging, things like high knees, um, lack of a better term, the butt kicks, side shuffles, some dynamic activity to kind of prepare yourself for exercises that have higher loads as you get into it, and then ultimately getting into the running. So definitely a big plug. I know a lot of us are busy and time crunched and maybe trying to get a run in during work or something. So oftentimes that warm up is something that gets pushed to the side, but I do think is a very important thing for preparing our bodies to take on the challenges of running and stay healthy. So a lot of these different exercises, probably things you've seen before, things like high knees and the butt kickers down there at the bottom, just kind of short distances, getting a little dynamic movement in. Also, not only thinking about the linear things of going straight forward and straight back, but also maybe integrating in some things like side shuffles to warm up the stabilizers and the sides of the hips. And then a super underrated thing, I think, is skipping. So for many of us, skipping is not something we've done since childhood, but can help activate some of the plyometric activity, prepare our bodies for more ballistic loads. And um, just as kind of a side note, it amazes me how many even professional athletes have kind of forgotten that coordination of skipping. So I think it can be very easy to do and great kind of low level plyometric exercise to prepare for other activities. So again, just kind of coming in, getting that good ground contact, popping off the ground, can help with other running mechanics as well. So again, in this program, just a few minutes of kind of these basic body weight exercises, getting the temperature up and starting to wake up the neuromuscular system a little bit. So in the program itself, again, the way that they did things was they had a core and hip strengthening program, this foot and ankle strengthening program, and the stretching program. For the sake of science, we oftentimes make things very kind of separate like that. So what they found was the hip and core program had benefits in terms of reducing injury risk in their population. The foot and core on its own program that didn't have much change over the stretching program. But I do think that even though when studied in isolation, that's the in this kind of novice running population, the foot and core exercises, didn't seem to have much effect. That I still think with the amount of repetitive nature that happens in contacting the ground, that it would make sense for somebody who's designing their own personalized program, specifically if you've had issues with your plantar fascia or Achilles tendon, um, other small muscle difficulties in the foot and ankle, that it would make sense to spend a couple minutes just kind of activating the foot, what we call the foot core, these smaller muscles within the arch of the foot. Specifically, again, as we're kind of gradually progressing this warm up and strengthening activity to get ready for running. So again, the goals here are to build intrinsic musculature of the foot and ankle, work on your balance and stability. Again, prepare your lower body for impact activities, strengthening things like the arch, the plantar fascia, and the Achilles tendon. So again, a QR code will take you to YouTube videos from this article, looking at kind of the full spectrum of these exercises. But here's what some of those things might look like. Um, and then a lot of them might be easier said than done. So things like individually trying to activate the toes, lifting up that great toe to strengthen the arch, and then the smaller toes on the side. Something that can be, again, very challenging is taking a towel and curling that up with the foot to strengthen that arch and some of the smaller muscles there. Things like balancing on an unsteady surface, that could either be a foam pad here or even just on flat ground, or if you want to challenge yourself but don't have a foam pad, can do simple things like take a pillow and stand on that surface. That can be done, either two legs, single leg, can integrate different squats on there. There's different exercises in the videos that involve things like throwing a ball to integrate some more dynamic stability, but just kind of picking out some of the really easy things to integrate into warm-up routines. And then finally here, the toe walking, again, just to kind of activate that foot and ankle complex to get yourself ready for the impacts that can happen with repetitive running. Then getting into the bulk of the program and what I would recommend based on my experience, and not even exclusively for runners, but I think no matter what your activity is, that this is a great program that could be integrated for things like basketball or pickleball or tennis. So spending after that kind of initial warm up here, the dynamic warm up, perhaps some foot and ankle strengthening, getting into some hip and core exercises. So over a period of um, as little as 20 to 30 minutes, at least 2 times a week, can provide some additional neuromuscular activation, prepare our body for those impact activities, and continue to build strength in our hip and core stabilizers, as running can be a very dynamic activity. Again, QR code that will take you to kind of a full list of different exercises that can certainly build on themselves and be programmed in a way that can be progressively challenging, but definitely listen to your body, start at a place that you're confident and comfortable with. So things as simple as different plank variations can, again, be low cost, easy equipment, and done anywhere. Things like just holding a static front plank. As you'll see here, she's doing a really nice job of keeping her back flat there, not kind of swinging side to side, but just holding that nice and stable position. That can then be progressed into some more dynamic actions, such as this bear crawl, where again, she's going to keep her back very flat and stable and just kind of working her legs out and back there for a little more dynamic stability. You can take that into another level of progression, get a little more hip and glute strength by going straight into some uh, leg extensions with a longer lever. That's why that'll be a little bit harder, is because you're moving more of your leg against gravity. And then coming in different variations that challenges the rest of the trunk and upper body, things like these kind of T rotations, or playing around with lifting up different parts of the body to create unstable surfaces. But again, very easy, simple things to integrate that can be helpful for whatever activity you're getting into. You can also think about these different side plank progressions, working a little bit more of the lateral hip. Can be helpful if you're having kind of the side of the hip, greater trochanteric pain or gluteal tendinopathy issues. Both those planking exercises would be helpful for lower back or SI joint issues as well. So starting with the static plank that we just saw, maybe integrating something like hip lifts as terms of a progression there. And then this next set of exercises, I think, is something that is it can be a little more challenging, but not only working the outside of the hip, the abductors, but here are these Copenhagen exercises. We're then working on the adductor as well. So strengthening the muscles through the groin, pelvis. Here, what she has doing here, she has her support more kind of at the level of the knee. So again, that's shortening that lever, taking a little bit of the strain off as a starting point. This could even be done on the ground and lifting up the other leg as a starting point there. And here she's progressed out to have a longer lever arm, or just has her ankle up on the table there, which would increase the work that those adductors have to do to help stabilize. So just another way to kind of take a very simple exercise and layer on difficulty and make sure that we're strengthening the entire complex around the hip. uh, Then kind of taking that into the posterior chain or these gluteal muscles, the hamstrings, some things as simple as just a static pelvic lift that can be held as a bridge, working on those hip and core muscles there. So we can progress that into a single leg variation. It's going to add a little bit more stability, challenge that single leg. Um, again, things you're doing just with your body weight and minimal space, so very easy to progress these things with minimal equipment. I am a big fan of these exercise bands. Again, a simple investment that I think can um, really help your strengthening routine. So she's doing a basic squat here with some extra tension around her knees to build a little more stability and strength in the outside of the hip there. And then can take that into various different variations, such as these side walks or monster walks. She's working hard to make sure her pelvis is staying level, good core stability, and again, working on that strength and stability through the hip complex. And you can be as creative as you want, doing things like these, kind of both hip flexor and glute strengthening exercises. You can see how this kind of starts to get very functional for a running pattern, this alternating side to side. You can take that up into a standing position as well, preparing those hip flexors, working through that, what we call a reciprocal pattern of lifting the leg and opposite arm. And with the right band and some creativity, you can even get in some posterior chain hamstring work. Again, very minimal equipment, doesn't have to be a lot of weight, but a little bit can end up making a big difference in terms of strength and staying healthy as you're moving forward. And then not to forget about simple things like just body weight lunges. A lot of people, are used to kind of the forward lunge, but this reverse lunge can also be a great exercise in terms of loading back in the posterior chain. When you're going backwards, it can take some stress off the front of the knee. So if you have trouble with lunges in terms of anterior knee pain, working in, those reverse lunges or side lunges can be a helpful strategy as well. So to summarize there, points that I think are important, having this background both from a strength and conditioning perspective and now as a sports medicine physician, I guess also myself as a now individual in my 40s who's trying to figure out how to balance an active job and kids and working in my own routines and feeling rushed at times. I very much emphasize the importance of this warm up and being very consistent with that before getting into our activities, no matter what that might be. Being consistent with some strength and activation routines. I think prudent to, of course, prioritize the hip and core strengthening, but also to integrate some of the foot core and stabilization exercises, particularly for our runners. I think kind of goal and a starting spot a little bit can go a long ways, but that study specifically was a twice a week routine. I think 2 to 3 times a week is very reasonable pattern that would be consistent with the activity recommendations from the American College of Sports Medicine. Important to meet yourself where you are and progress gradually. So we hit some highlights there, but again, if you go through those links or are able to access, that article specifically, there are certainly progressions in those exercises. You can start where you're comfortable and work your way through. I think I would emphasize again that a lot of times we're thinking about barriers, whether that's just kind of time and accessibility, expense, or, I don't feel like I have the means right now to pay for a gym, but I would emphasize there's a lot you can do with minimal and inexpensive equipment, whether that's body weight, like we demonstrated, a simple elastic band that can be purchased for a few dollars off of Amazon, things like a towel, balance pad, or pillow, and then something we didn't talk about just goes outside the scope of the article, but there's also these different suspension trainers, which you've probably seen, that are kind of ropes with handles that can attach either to a fence or tree or within a doorstop. And those can be an effective way to get some upper body strengthening in, and also very effective in different core strengthening variations as well. So beyond the focus today was on kind of the strength and what you can do in those routines with some very simple measures to optimize your longevity as a runner, but some additional recommendations that may have come up in different sessions, or common things we get asked are, what kind of shoes should I be wearing? I think that literature is very scattered. So ultimately what it's come down to is whatever is the most comfortable shoe for you and your body. And then to make sure that you're replacing that every 300 to 500 miles. So that can take some trial and error, but there's certainly not a one shoe fits all. You get into the weeds on the discussion of minimalist footwear and things like that, but ultimately it's what's most comfortable for you, and then being gradually and progressive in your training, getting used to that. Very important to prioritize your sleep, recovery, and nutrition. I want to avoid abrupt increases in your running volume. So particularly if you're more of a novice runner, I would recommend sticking to more like a 10% mileage increase per week. If you're more experienced, can think about increases, in more of a 20 to 30% range, but certainly want to scale that as you're getting into your higher mileages as well. If you're just starting out, I would limit the amount of days that you're going back to back, just to, be able to more closely monitor how your body's responding and make adjustments to your routines. Always a question of like what's soreness and what's pain. So if pain's starting to affect your gait, and particularly it's getting worse throughout the course of a run, I would certainly come see one of us sooner than later. And I would also emphasize, as I have in previous sessions, that you don't have to be hurt necessarily to see a sports medicine doctor. I'm very happy to and glad to have these conversations with folks who are thinking about a new routine or have an injury history and are just wanting to see what they can do, like we've talked about today, to mitigate some of those risks. So I think many of us are certainly happy to have those conversations, and always would prefer to do it in a time where we can help navigate some strategies to avoid injury versus then having to do things that alter your running goals. And if you're heading into a race, that's a much more difficult situation than if we can assist with planning and getting ready for whether it's the upcoming marathon or any activity that you're looking to do. And also just have a plan and listen to your body. So thank you, everybody there. Certainly feel free to reach out at any time. It looks like we do have some questions in there. So yeah, see the question about the slide links. So yeah, I built this in a way that I'm happy to have Sebastian share it and QR links, or we can link some of those videos in another article, whatever is best. Uh, so if time, would I prioritize a warm up over a cool down? And yes, I would absolutely prioritize warm up and dynamic activities. The literature on injury mitigation with stretching is pretty limited. So I think oftentimes the thing that gets cut short is kind of the strengthening and particularly, the warm-up period. So if we were um, in a place where we had to choose one or the other, I would advocate for making more of a priority in terms of strength stabilization, warm-up routines.
Amazing. Thank you, Dr. Kenya. I just also want to mention that there was another question earlier is if the SI joint is a common place for injury for runners.
Yeah, I have several runners that have had SI joint issues. Sometimes that's a case where there's clearly something going on. Oftentimes it's more of a muscle balance issue. And, um, I think in particular, if you're someone who has SI joint issues, that's certainly an area where I would, try to build up some strengthening routines in an off season. It can be, a tricky issue to um, mitigate, uh, as you're coming up into a big race and already at kind of higher volumes. It's well, we can work on some strengthening. Then uh, it is something that if you're having issues leading up to a particular race, that then we'll usually take a period of downtime afterwards. Um, you know, and focus on that therapy and strengthening. Rare circumstances, certainly it's an area where you can get bone stress injuries and things like that. So also an area that can be, because of the complex nature of the back and the hip, that oftentimes when we're having, quote unquote SI joint pain, that oftentimes what we find is that's either an irritated disc or nerve from the back, or a lot of factors that can play in back there, but certainly on the list of running injuries as well.
Understood. Thank you, Charlie. I think there was oh, this was an interesting one. Would you know if there's any truth to needing to rest your shoes? Would you have any recommendations on regarding having multiple pairs of shoes in rotation, or is that just propaganda from Big Shoe?
Yeah, I haven't heard as much about the idea of resting the shoes, as much as, something that has been studied and has been repeated in a couple different studies, this idea of that as the shoes wear out, a lot of people kind of quote this kind of 300 to 500 mile range. You can certainly monitor the wear patterns on your shoes as well. In terms of resting shoes in between, I'm not as familiar with that, but I think if you are a very consistent runner, thinking about rotating your shoes every 6 months to a year or so is a very reasonable thing to do.
Understood. Thank you. Uh, Oksana asked, could you please remind us again when to do static stretching and when to do dynamic stretching? Like say, for example, if I only had 10 to 15 minutes, what would be the best to do?
Mhm. So again, the evidence with the static stretching and any like injury mitigation is pretty limited. So uh, I don't feel strongly about doing any static stretching. But I think a dynamic warm-up period can be very helpful. Both some of those, if you had 10 to 15 minutes, I still think you can get a lot in. Again, 5 minute period of kind of getting your heart rate up first and then getting into some, pretty quickly, few reps of, various core activation, maybe some lunges, along with some bridging and other activities that you can get a lot out of that. I think people are often deterred, if they do feel very time tight, that, oh, if I can't do anything, it's not worth doing anything at all. But I think the opposite is the case, that even a little bit can go a long ways, especially in our runners who, it's just a very repetitive activity. So I think a little bit of cross training can go a really long ways.
Understood. Thank you. Jackson asked, could extended stretching, like over 2 minutes, cause muscle soreness?
Um, I I think, if you do anything to an extreme, that you can have some kind of adaptation and soreness that can occur with that. I don't think it's going to be very individual. Again, it wouldn't be something I would necessarily prioritize in terms of those prolonged static stretches, particularly before activities. there's some evidence that doing a long static stretch before an activity can actually inhibit or shut down the muscle. So if you were going to do, longer static stretching, I would save that probably for after an activity or after a run. Whereas prior to run, focus more on the kind of dynamic activities, warm up, and some of that strengthening as we discussed.
Got it. Thank you, Dr. Kenyon. Um, Pat asked, do you have an opinion on using ice bath or cold water immersion post a long run or high intensity training? Would frequent use block adaptations?
Yeah, I think that discussion for me, kind of comes down to an anything in moderation type category. I think if you're somebody who's having a lot of kind of joint discomfort after a run, then it can be a reasonable strategy for managing some of that discomfort. The concern, as you suggested, Pat, with frequent ice bath use is that not necessarily for the endurance adaptations, but uh, that the ice baths, there's multiple studies that suggest that frequent ice bath use can inhibit muscle and power development. So um, I think if you're going to utilize that, kind of a once or twice per week type thing is probably fine. But if you're doing it daily, um, I do worry somewhat that that's going to impact some of your muscular development over time.
Thank you. Um, Also, I wanted to mention if anybody else would have any questions, yeah, please feel free to use the chat or Q&A function. I think you are all also able to unmute if you'd like to voice your question as well. But while we wait, Charlie, I just want to thank you so much again for taking time out of your day to share with us all your expertise and learnings and the research you brought in as well to today's session. And yes, if I believe, yeah, I will be just if anybody missed it, I will be sending out this, reaching out to Dr. Kenny for the slides and a recording and attaching that and sending that out with the recording to today as well. Um, and it looks like Charlie did have a question here. When should we consider wearing a knee brace or a strap if we are experiencing soreness?
Yeah. Uh, Before getting into that, I'll just say while I have it up here, this is the link to the hip and core YouTube videos. So if we'll get everything out to everybody, but if you're looking for one thing to take a snapshot of, feel free to scan that code and check out those kind of full extent of those strengthening exercises. In terms of knee brace or strap, that's similarly something I put in to a category of potentially helpful, definitely safe. I think that those types of things are very unlikely to cause additional issues. So the in runners, the more bulky knee braces can be more of a challenge, but there's a lot of great kind of knee compressive sleeves that a lot of people feel a lot very comfortable in. The so I usually recommend people start with the knee sleeves just because there's a lot again that can be obtained for fairly cheap from sources like Amazon. Have different sizes. Oftentimes you can get two, so you can kind of wash one, wear one. Um, the knee sleeve for just kind of general knee pain, soreness. The strap is more for if you're having tendon issues. I do have some people who like a strap, even if they have more patellofemoral pain. So my spiel on bracing is oftentimes, again, that I think it's very safe. It's unlikely to cause other issues, and some people certainly find a lot of benefit from that. But it can take a little bit of trial and error in finding something that's the right solution for you in terms of comfort and fit and things like that. Um, So, yep, for the again, runner's knee technically is more of a tracking issue with the patellar joint itself. So, um, there's certain braces or certain sleeves and braces that market helping out with that. Some people, especially working with physical therapists, will try different taping strategies, whether like a kinesio tape or similar strategy. Jumper's knee is classically more of a patellar tendon issue, so those are typically more the strap type solutions to help offload the tendon. Um, and again, I think if you're having, a little bit of an issue, it's certainly something that's easy to try and safe and potentially helpful. In terms of benefit of compression sleeves for the calf or the full leg, um, again, that's something that I see no real downside to. I would say um, some of those issues, particularly if there are things that are getting worse with running, I worry a little bit about, treating something that you feel like is more of a muscle cramp or that type of issue that might actually be in a high volume runner, more of a kind of bone stress injury or stress fracture that's starting to develop if you're using the sleeves for like shin splints or something like that. But the kind of idea there is that they're going to help with blood flow and venous return. So it's something I see little downside to, and some people really really like. I think just making sure it's not too tight, that's not cutting off your blood flow. But um, I think the compression sleeves are one thing. At a certain point, if you have these compression things all over your body, I think there's also some great kind of compression leggings that can be very easy to use, and especially in our kind of fall and winter climates that we're getting into, or good fits for that. Um, uh, but again, kind of that definitely safe, potentially helpful category of things. Looks like I got to Monica's question a little bit, but yeah, the kinesiology taping I think is, safe, potentially helpful, certainly not a one size fits all strategy. If you don't have much experience with that, usually I would recommend, if you're interested in trying it, discussing strategies with a physical therapist, just because doing some of that on your own for the first time can be a little intimidating. Also, some of those tapes can be a little bit expensive over time, um, but for the most part, you are well tolerated. Um, Outside of some people have some adhesive sensitivity, stuff like that. Um, Robin's question here about staying away from running to prevent wear and tear on joints. So specifically from joints in the larger studies that we've looked at, this is tens of thousands of runners up to marathon levels. Big studies like the Osteoarthritis Initiative, that we haven't found any evidence that running at moderate volumes progresses the rate of arthritis progression. So the people that have faster progression of arthritis are people who are very sedentary, have other metabolic issues. Moderate runners, people are doing a couple miles a week up to marathon distance, seem to have same or lower rates of progression compared to the average population. And then, you do have your extremes of the ultra marathoners that start to get into a lot of kind of repetitive use, and they may have a little bit of an increased risk of arthritis progression. But the far majority of people who are running recreationally, even up to doing a couple marathons a year, we don't have any evidence to support that they have faster progression of arthritis compared to the general population. Arthritis is a very complex thing, involving metabolic factors, genetic risks, injury history, and as we've evolved in our understanding of arthritis, it's appreciated to be, again, much more complex than our traditional kind of wear and tear thoughts. So uh, that being said, listen to your body, progress gradually. Make sure you're doing the things we talked about in terms of strengthening and um, listening, and making those other modifications that you need it. But I would not let the fear of progressing joint pain or arthritis keep you from getting into running. I think you just need, if you have had issues, you just need to be very thoughtful about how you're doing that. this question of a bone spur, stop short of giving medical advice in this setting, but we're happy to see you at any time. If you've been having that much trouble, may also be worth seeing a podiatrist for custom insoles. But in terms of specific injury recommendations, I think that's beyond the scope of the webinar.
Thank you. I also wanted to mention on this kind of similar topic, Dr. Kenyon, that could somebody make an appointment to come see y'all if they were just curious about seeing if they're running correctly with like a proper form, even if they're not injured?
Yeah, absolutely. In terms of like a gait analysis, oftentimes what that also involves is partnering with some of our physical therapists too. Um, but like I said before, especially from my perspective and background, I certainly am more than fine, and if anything, uh, sometimes prefer seeing people before they have injury just to see what we can do to keep you healthy. So don't feel like you need to be hurt to make an appointment with us.
Yeah, the point is to prevent,
Yeah.
not to treat, right?
Yeah, yeah, I know just having some of those long-standing relationships can be, helpful for a variety of reasons. In terms of, compartment syndrome, again, that can be very individual thing. It's definitely a diagnosis of exclusion, so you want to make sure that don't have other things like stress fractures that might require a lot longer period of offloading. And then it's kind of gradual progression, making sure we're addressing underlying biomechanical factors with compartment syndrome. Um, but oftentimes, we can manage those things conservatively. If we've kind of confirmed a compartment syndrome diagnosis, then sometimes people have various different surgical procedures to release those compartments. But similarly, it would be something that if it's been ongoing, consistent, I'd recommend getting evaluated, not only by your physical therapist, but potentially with a physician as well.
Understood. I think we just have one last question there, Dr. Kenyon. It's just, what is the best posture to prevent a knee injury in walking?
Hmm. Um, so in terms of walking, you know, um, I'm not sure, specifically on the posture side of things, more from the running literature. There's some evidence to suggest if you have a shorter stride length and an increased cadence, that can reduce joint forces. Oftentimes, if people are having difficulties with walking, I'll recommend things like trekking poles can be a helpful way to offload. I think similar, we talked about shoes in the context of running, but making sure that you have a good, fresh, supportive shoe can be helpful there as well, plus or minus the different bracing strategies. And I think even with walking, again, making sure that you're integrating some other strengthening exercises to help with supporting the hip core and the knees. Um, I don't think that this last question about golf, I wouldn't categorize any physical activity as bad for your body. I think it's important to listen to your body, make sure you warm up. If you're new to, things like golf, certainly a unique movement pattern. So again, just kind of being gradual and progressive as you're getting into things, potentially even seeking some professional coaching to help address any of those underlying factors. Similarly, we have both physicians and some physical therapists at the stadium clinic in particular that have interest in things like golf. So if you had concerns, again, we're happy to get you in and get you plugged in with the right resources. Yeah, particularly if you're coming back from you know surgical injury, those would be the kind of things where I'd encourage you to work closely with a physical therapist. Um, I think the nature is as you're getting back into that after a while, is you're probably gonna have a shorter stride, anyways. But um, in general, with the kind of linear activity of running, you should be able to get into that on the earlier end after an ACL reconstruction. It's more the dynamic activities, the side to side, the cutting, the impact things. But the running progressions usually start pretty early on. And again, to your point, making sure you're doing that as being appropriately cleared by your surgeon and therapist and the rest of the team.
Amazing. I think that should be in, I believe, for all the questions. Charlie, thank you so much again for your time today. And
Absolutely.
yes, and one more time, I will be sending everything out to everybody once I have everything uploaded. So I appreciate everybody also for attending today's session. I hope you all have a wonderful rest of your Tuesday. And please be on the lookout for the next session in October as well. So today covered mostly injury prevention, the physical side, but next time we'll have a Polo coming in from, I believe, athletics to come talk about the psychological and the mental side as well of training and just continuing to get or keeping your motivation, staying focused. So, but thank you again, everybody, and we'll be in touch soon. Have a wonderful rest of your Tuesday, everybody. Thank you, Dr. Kenyon.
Thanks, guys.